And I'm talking to some doctors that he works with. I just want to showcase, the achievement of our doctors, immigrants, Nigerians like us, what they've achieved being here in Canada and being a doctor here at the Ebenezer Medical Clinic.
There are several doctors that work here from Nigeria, and you're going to meet most of them one-on-one, and so you see how they work here.
Yes, Dr. Akolisa is amazing. He's very supportive.
Guys, this is Dr. Akolisa Anyanduba, the owner of the building behind you. The building was opened today. We're here to just chat with him. First of all, doctor, congratulations on your new building.
Congrats, doctor. He's very supportive of our people, the immigrants, and he encourages them and gives them a chance to also use their skills in the medical world.
So, wait, sit back, and enjoy. Tell us a little bit about Ebenezer Clinic.
Ebenezer Clinic was started in 2007. That was when I registered it.
Okay.
So it's good to meet you, doctors.
Yeah, nice to meet you.
We're super proud of you guys, and we just want you to tell us a little bit about the Ebenezer Medical Clinic. We know your doctors are...
Yeah, I'll go first. So,
prior to that, I was working in another clinic here in Red Deer, and I decided to consider starting my own place.
my name is Dr. Ike, and this is Dr. AK. The Ebenezer Medical Clinic is one of the biggest clinics in Red Deer, if I would say. And we're glad to be part of the team.
This is the doctor's office. This is where we have the doctors. So this is one of Ako's doctors.
I had some values that I wanted to bring into the medical space. So we first got it registered with the city.
The clinic has been in existence since 2019, I think 2018, or precise. Yeah. And we've watched the clinic grow, over the years. We've had new doctors come and join us. We've had a huge patient load, and it's been good from leaps and bounds. As you can see, we're doing a barbecue today
For the opening.
which is customary for Ebenezer. We've always done barbecues every year.
Wow.
But today's is special because it was it also marks the opening of the new building. It's a historical building. I'm sure we all know in Red Deer. It's about the oldest medical building in the city of Red Deer.
Her name is Dr. Chidi Akude. Tell us a little bit about yourself.
Well, my name is Dr. Chidi Akude. I'm a doctor here in Ebenezer Medical and Walking Clinic, and I am also taking patients for the meantime. And this is a fun, loving place. Whenever you come here, you feel welcome, you feel heard. The doctors here listen to their patients, so come on and come join the team.
I had some values that I wanted to bring into the medical space. So we first got it registered with the city.
So we're very proud of our achievements as a clinic, as a group, and yeah, it's good to have everyone around.
Nice.
Thank you, Dr. Ike. Wow.
So,
Doc?
can't wait to expand further, but having to run 3 sites didn't make economic sense. So I knew that there was a need for us to try and get a big space that will accommodate us.
Dr. AK.
Yep.
Tell us a little bit
about
you, Dr. AK, with
Yeah.
the Ebenezer Medical Clinic.
Okay, interesting question. Well, for me, it's going to be a more concise experience because I joined the clinic about 1 year ago. So this is one of the archival members of the clinic. So
But he's not an archive man.
I know, he looks very young, right?
He's very young.
So he has said it all about the clinic. I joined the clinic last year, and all I can say is the experience has been phenomenal. When you walk in a space where the energy is cohesive.
Yes.
You walk in a place where everyone is trying to be there for the next person, support each other. You can come out and express yourself, and no one is seeing it in a negative light, but how to establish growth That's what I've experienced in the past 1 year.
Skyway to expand further, but having to run 3 sites didn't make economic sense. So I knew that there was a need for us to try and get a big space that will accommodate us. And we're still growing at that time. At the time we made the decision to start looking for a space, we were 6. Now we're 11. And
Ebenezer has grown. We started with just one small space with about 3-4 rooms or so, and we moved on to, I think at some point we had about 16 rooms. Now we're here. This should be containing about 25-30 rooms. I'm not sure the exact number. So it's been constant growth for the clinic. We have an amazing, I would say, leader and owner of the clinic, Dr. Ako, who has been an absolute pleasure to work with.
And definitely having a big space was very necessary.
So the reason you bought this building is to increase the space for your doctors and expand your clinic.
Yes.
I have one question for both of you.
Go for it.
How do you feel, both of you, working with your wives in the same clinic as doctors?
You're trying to set us up.
No, I'm trying to ask you the real life question.
Okay.
Both of you have doctor wives and you work in the same clinic.
Go for it.
Well, I mean, I met my wife in medical school, okay, and we've been friends all along up to date. So it's usual life for me, you know.
Good
We've
for you.
We've been in the same classroom, we've worked in the same hospitals, all the way up to this point. So it's like business as usual.
Nice. I understand that this is the oldest medical building in this city. Is that correct?
No, that's what it is.
So now it is owned by you and your business. Today the city mayor was here to cut the tape to this building. So what is your expectation for your clinic in this new building?
I expect that we'll expand further in terms of number of patients we treat and the physician resource. Like what I always do, I encourage my physicians to try and develop extra skills so that they can offer additional services to our patients.
For me, I think it doesn't really make much difference because sometimes we come to work together, we don't see ourselves until we're leaving.
Oh,
Right? Because we use different rooms.
yeah.
And we're busy basically.
Yeah.
I'm not saying other people are not busy, but most people will understand that doctors are really very busy people.
Yeah.
So the only part of it that makes it a little bit different is the fact that we get home and we're talking about work. So it's like we take work home and home, work home, there's no difference.
So
But it's
work-life
been
balance is a different.
No, I think it's
dynamic.
fine sometimes because sometimes some couples don't even have a lot to talk about. So if you talk about work, talk about everything else, I think I wish we
Yeah.
actually work together. to
Don't
be
we
honest.
work in the same
Well,
office together
we work
sometimes?
together on our business, but then I really like the fact that you get to see each other even at work. You're not on the phone chatting. Where
Yeah.
are you? How are things? Are you okay? So I like that.
Thank you guys. I
Thank
appreciate
you so
your
much.
time.
We're so proud
Yeah.
of you guys.
Yeah.
Like I do emergency, I do operational medicine, and I also do hospitalist. Dr. Ike does oncology, which is cancer care, in addition to working in the clinic. Then Dr. Linda does child psychiatry. I forgot, I also do child psychiatry. So the aim is to offer our patients more services and reduce wait times for them, because if we have to refer them to a specialist, at least it will a minimum of 1 month before they get to see someone. But if there's someone in the clinic that can deal with it, it will be a question of days. So and we also want to see whether we can bring in the geriatric team. They are looking for space at the moment in Red Deer. So I've spoken to Alberta Health Service and I've spoken to their head of department, because that would be a big service if we were to host them in the building.
This is a massive step for a Nigerian doctor here in Red Deer. This building right behind you there is the Elim Professional Building.
Let's show the building.
This is the building. You can see the massive building
huge.
owned by Dr. Akolisa Anyanduba, whose business is Ebenezer Clinics, and we're here to rejoice with him today. He's been hosting us since afternoon. The mayor was here. He has been expressing massive congratulations that we can get the number of doctors working in this clinic for this city. They are very happy. So once again, doctor, congratulations.
And where are we?
We are here in Ellen Building, and today is the opening ceremony. And yeah, whenever you come in, you can always come take a look and see how beautiful this place is.
Beautiful.
We have a wonderful view. It's a very warm environment. So please come in and join us.
Awesome. And we are in Red Deer. This is one of the beautiful doctors here in Ako's office. She's just told about herself. You can see doctors are doing extremely well. Our Nigerian doctors are doing so good. So this is their office. They're doing a lot. They're contributing here to our city, and they're doing awesome. So guys, we are proud of our Nigerian family. We are proud of what Nigerians are doing. So we're super excited to be sharing this with you. So come with me and let's keep looking. Yes, and I just want to add that this is part of the Red Deer development, and the mayor is super proud to see this development coming to Red Deer, because Red Deer is a growing city, and with this has added to the growth of the community. And we're very happy to even see the doctors that you're working with. It's very impressive to see, other doctors being part of this journey with you.
Thank you so much, and congratulations.
Congrats, Dr. Ako.